Hello everyone, my name is Mehani and today I would be talking about the non-oral route of medication and it's an infographic. Yep. So we would be discussing about Mike who is suffering from a fungal infection in his foot and doctors gave him a tropical cream called Xylol. He will get this cream twice daily in the morning and at night for 2 weeks. After 2 weeks, there would be an increase in infection. Then he needs to show to the doctor. So, as you know, that Xylitol is an antifungal medication, helps to prevent the fungal from growing into someone's skin. So this was the look which Mike was suffering. Like has this, as you can see on the screen, that there is like the fungal infection on it. So we are discussing about this as a direct support worker. You need to like go through all or give the medications to many people. So what things you need to keep in mind, or even if you are just being a person who is supporting someone or at your home and someone is suffering, how to give a proper medication in a certain manner. So we would be talking about. So the slides discuss about the equipment. As you can see, if you're giving someone a gel or a cream, then you need to have gloves, a cotton applicator. As you can see, the picture on the right hand side, it just looks similar like a cotton swab, like earbuds. It's just a cotton tipped applicator, gloves, and the gel. So the steps are so simple. So first step is that you need to wash your hands with sanitizer properly, just 3 seconds, wear gloves, ask the person to sit in a proper position, or if he's sitting on a bed, so make sure that he is hanging his head down towards the floor and he's not sitting till the end and like that, because if you are keeping the his feet on the floor like a standing still, it would be really nice to apply it, or else it might be just rubbed in bed sheets or it won't be staying for a longer time. Then after asking the permission person to sit, because it's very important that you ask the permission and to sit in a proper position without him knowing what you are doing. So the next step would be squeeze the medication in your hand, and with the cotton applicator you can apply it on the where there is fungus, you can see, or you can apply with your fingers, but make sure to change the gloves if you're going to another toe or another feet or another leg or hands if it's in the hands every time, so that the infection does not spread it around from one to another. And make sure after that, throw your all the items like the cotton swab, a tipped applicator, and the gloves and the dustbin, and ask the person to sit for the 30 minutes in that position. Even it's the similar rule after giving the drug, that you make sure that he is sitting in 30 minutes in that position, and you're checking him after 30 minutes to see any reactions are there or not. So that was the simple steps to identification. What things needs to be keep in mind, that while giving this medication, that he should not be going too near any inflammatory things or smoking area, because this might have a reaction and it might cause a fire. Make sure that we are not putting any bandages or like causes or any dressing over the infection, because if a person is suffering from fungal infection, then it needs to be like open, not closed. If a person is having a burn, irritation, or redness, stop the medication immediately and call the doctor or visit the doctor as soon as possible, so that what next step needs to be taken. What are the allergies the person might be having, like stinginess, like a pus around it, severe irritation, and mild transient. So as a DSW support worker, you need to make a record, or if you are supporting someone not as a DSW, as a PSW or something, then also if it's in your role, then you might need to write down the documentation, like when you have seen the person is having irritation or redness or shortness of brains breathe as the side effects. So just call the doctor and note it down what the doctor has been giving the conversation. Uh, Four things which you need to keep in mind while you're supporting person. Make sure you wash your hands before and after applying the medication, and make sure that you inform the person that what are you giving the medication, how much its amount, or why you are giving the medication. Or also offer him choice, like if you're giving a meds like a pills or something, do you want with water, or you want with a half warm water, or you want some with something, or what choice of the food, or like you want to sit or lie down in what position. But make sure you are going through all the necessary things, and it's not being difficult to give that medication, and respect the person if he don't want to have it, or if he don't want to follow that choice which you gave. Respect that. That's it. And the last is the references. I have like got all the information, and this is a short video. YouTube, you can go and see it. It's just describe the basic information and what the process was through, how these videos have gone. Thank you.